Hi everybody, my name is Dr. Roger Tsai and I'm a board certified plastic surgeon here in Beverly Hills, California. So today we're going to go over the process for a breast augmentation procedure. So I made another video talking about the differences between silicone, saline, textured, smooth implants. It's a whole big video, so you can go check that out separately. But today we're just going to go over the consultation process, answer some questions that most patients ask, and give you an idea of how the surgery works. So for the first aspect of the surgery that we review is the difference between silicone and saline. Again, I've gone over that previously in another video, so I urge you guys to check that out so that you are knowledgeable about the different types of implants out there. But the most popular implant nowadays are the gummy bear silicone implants. The second thing I go over is where do we place the incision? So I go one of two ways, either around the areola or underneath the breast tissue at the breast crease. Whether you go around the areola or underneath the breast tissue at the crease, each incision is about 3 centimeters in length. When it comes to this option, there's not much as far as recommendation of which way to go. One incision is not necessarily more superior than the other. It really just all depends on your own personal lifestyle. For patients who do not have a well-defined breast crease, or for those patients who tend to scar darker and thicker, the recommendation may be to go around the areola because a darker scar will blend into a darker areola a little bit better, and a patient who doesn't have a very well-defined breast crease might notice the scar more if placed in that area. However, for a patient who does have a well-defined breast crease, going either around the areola or at the breast crease, the scar will be hidden very well. Lastly, we talk about where do we place the implant, whether it's above or below the muscle. For most patients, the recommendation is to go below the muscle for two main reasons. Number one, the risk of what we call capsular contracture is a bit lower. And number two, there's more cushion and more tissue to cover the implant if it is below the muscle. Therefore, you're going to see and feel the implant a lot less, giving you a more softer and natural look and appearance. During the consultation process, we'll try on all different types of implants to make sure we pick the right one for you. This procedure is done under general anesthesia, so all patients are fully asleep. Because of the anesthesia, it usually takes about 2 or 3 days for patients to feel back to normal. As far as timeline for the recovery goes, the first 2 or 3 days, I always talk about it like a lazy weekend. You're kind of just sitting at home, bed rests, on the couch, moving around a little bit, but mainly just watching TV and having somebody take care of you. Within a few days to a week at the very most, you should be back to doing most, if not all, of your normal daily routine and activities, including going back to work. So there's two main things I don't want you to do during that first month of recovery. Number one, no heavy lifting. 10 pounds or less, so purses, backpacks, laptop computers are okay, but anything more than that, we do want you to hold off on for that first month. For my patients who are very active, I will allow you to do lower extremity isolated exercises such as body squats and body lunges, or even hikes once you feel better after about 1 to 2 weeks. The second thing I won't allow you to do for the first month is any soaking. So no hot tub, pool, jacuzzis, or baths. Running shower water after 2 days is fine, and you can shower for as long as you want, just don't soak in any water. So after we hit the 1 month mark, I will allow you to start working out and allow you to start taking baths and start soaking in hot tub, pools, and jacuzzis. Do understand in the beginning that implants are going to be high, full, tight, and almost fake looking, so there's going to be a little bit of an awkward appearance for that first month. It does take 1 solid month in order for the implants to settle to a position where it's more presentable. However, do understand that it can take 3 and up to even 6 months or more for the implants to fluff, settle, and drop to its final position. The reason for this timeline is patients who have smaller implants, there's less stretch, and the recovery will be a little bit quicker. Those who pick a larger implant, the stretch will be more, and therefore it takes a little bit longer to get to that final result. So these are the general topics that we talk about and discuss during a consultation process. Obviously, every single patient is going to be different, and we adjust the procedure a little bit differently for every single person, which is why a consultation is very important. But I wanted to make a video for you guys, at least to get the ball rolling and started. I hope this video was educational and informative for all those patients that are seeking a breast augmentation procedure. If you would like a consult, please reach out to our office and we'd be happy to set you up with a consultation. Comment below if you have any questions. Otherwise, follow us for more information.